Some people are avoiding knee surgery these days, a breakthrough injection that helps people with osteoarthritis in the knees. Dr. Eric Lee from the Spine Institute joins us along with patient Raleigh Huntsman. Thanks so much for being here.
Thanks.
Dr. Lee, 60 million Americans suffer with chronic knee pain because of osteoarthritis. First, if you were to break it down, what is it exactly?
Well, osteoarthritis is also known as degenerative joint disease. It's the most common type of arthritis, but it's where the cartilage in the joint breaks down and wears away, and then the joints come together and it starts rubbing against one another, causes pain, swelling, decreased range of motion.
Quite a bit of pain and discomfort for people who experience it.
Yes, it's not a fun thing.
There have been some non-surgical options in the past for OA, but you have a new program that's actually pretty successful. What are you doing differently that's working?
You know, that's the most common question we get in the office, and there's really two things that makes us different. One is how we put this injection into the knee. And when you bring, I brought a little model here that we can show, but when this is the main key point of how we want to make sure that the injection goes directly right into the joint. That's specific, so it's in there and it's going to work. The second part is that we have a specifically designed physical therapy program for each individual that comes in, because osteoarthritis can be caused by many different ways.
Well, you were experiencing some pain before you saw Dr. Lee and the experts at the clinic. How do you feel now after going through the program?
Feel really good. It started when I, maybe 10 years ago, I had problems with my knees, starting to have problems, and my wife kept saying, go have surgery. I didn't want to have surgery. So lo and behold, a newspaper came out a few months ago, and Dr. Lee had put an article in there that talked about the same problem that I had. And I said, well, I'm going to find out about this. So I called him. That was on Sunday. I called him on Monday, and he said, come on in and bring your x-rays, which I had. And he looked at it and he said, that we can take care of that.
And the non-surgical option really appealed to you, the injection procedure.
It absolutely did.
How long does the procedure take?
You know, it depends on if someone has a direct diagnosis of osteoarthritis. It can be 6 to 8 weeks, depending on what they have. So they can call 1-800-NEW-CARE, have them make an appointment, and see if that is osteoarthritis. We can help them, because if it's a ligament or meniscus, that's something that we're not going to be dealing with.
And it certainly worked for Raleigh. So glad that you're feeling better. The knees are feeling better. Who qualifies for the program?
It can be anywhere from 30 years to, we have 90-year-olds in there. It just depends on if it's osteoarthritis, and we take some specific things that we do to make sure that that's what the correct diagnosis is.
And if people have questions, maybe they're in the Raleigh situation, not reading the article, but seeing it here in Studio 5 today, how do they get a hold of you?
Yeah, call 1-800-NEW-CARE, make an appointment. We will see if that's something we can handle. If not, then we can refer them out to a proper physician that can help them with that.
Perfect. If you're looking for a non-surgical option to get rid of that pain, you can certainly visit their website, utahspineinstitute.com, and we'll link you there from the Studio 5 website as well. Glad you're feeling better. Thanks for telling us about your experience, and thanks for telling us about the new option.
Thanks.
We'll be right back.